Epidemiology and Control of HIV in Washington, D.C. My name is Sonia Barrientos, and this is my presentation. Washington, D.C. is a district. The population is estimated to be around 700,000 people. The average age is 34.5 years old, and the average income ranges from 88,766 to 106,287. The poverty level is estimated to be at around 14.43%. The timeline of the HIV outbreak in the United States is as follows. In June of 1981, the first case was reported. Um, at this time, it was reported in a homosexual man. By 1982, the epidemic was growing at an alarming rate, and the Congress had to get involved and take some action. By 1984, the virus was officially identified by the National Institute for Cancer Research. First, it was thought that the HIV was a rare virus that only affected homosexuals. Therefore, the National Cancer Institute was the one doing the research for it. They identified it as a virus, and by 1986, it was estimated that there were 1 million people in the United States infected. The first medication didn't come until 1996. It was called the AIDS cocktail. This was a combination of different medications that were attempting to control the virus. While the country was alarmed and involved in research and medication, the District of DC had neglected the virus completely, so much so that a lot of public outrage was there was a lot of public outrage and criticism, and in the early 2000s is when the district started addressing the virus and the epidemic within the district. At this time, DC had rates of infected comparable to some countries in Africa. Um, and they developed some goals. Government entities and community partners developed goals to address this epidemic. Their goals were, as they are now, the 95% of the status awareness. The first thing is that people need to be aware of their status. People need to be counseled on prevention methods and viral suppression for those affected. Nowadays, they have this model which they follow, and the programs are regularly evaluated and updated based on the needs of the community. Currently, the HIV burden in DC is about 11,000 people living with HIV, which is 1.7% of the population. Anything above 1% of the population infected is considered an epidemic. So they still have what is considered to be an epidemic of HIV in DC. 94.9% are estimated to be aware of their status. There were 140 new infections in 2024, and in 2021, there were 337 people who were HIV positive who died, but only 62 of them were related to HIV, which is a small percentage. The incidence is 24.5 people per 100,000 people in the city. When we're talking about who is affected in DC, 71% of people affected are people of color, which denotes a unusual amount. And among these people, the most affected are Black men who have sex with men, Black women, and Hispanic men who have sex with men. The age group mostly impacted in this day and age is the 20 to 39 years old demographic. Risk factors of the people infected. There's people who have sexually risky behaviors, such as lack of protection or IV drug use. There are a lot of barriers to getting treatment or counseling. Among them are the stigma of HIV, homelessness, poverty, lack of insurance, also lack of education, and lack of employment. All of these things prevent people from knowing their status and getting prevention or getting treatment. For prevention, the most widely used is PrEP, and it's been distributed and counseled for adults, but now they are seeing that a large amount of younger population from 13 to around 20 are not aware or are not using PrEP. DC has certain plans in place for as prevention methods. One of them is routine testing at every medical setting. This has been implemented since 2006. The only uh, caveat is that it's an opt-out model. So if people don't want to do the test, they can refuse it. Some officials are trying to change that to where everyone has to get it tested routinely, but they haven't gotten to that point yet. Also, they are doing targeted testing in certain high areas, in certain populations with high risk, and they are doing counseling for people who are affected and PrEP access for people who are not affected but have risk factors. DC has developed a four-part strategy. One of them is screening, screen everyone, anyone and everyone who is sexually active. The next step is linking to care, whether it be for affected people infected or for people who are at risk so that they can get or they can be counseled on prevention methods. The third point is engagement and retention. So people who are infected can uh, take their medicines and reduce their viral load, and people who are at high risk can consistently access prevention methods. And the fourth is the drug therapy, whether it be for infected people or for people who are at high risk, that they can get access to their whatever medicine they need. Uh, this this plan doesn't work without community involvement and also um, clinical places uh, taking part in this fight. The focus at this time is in the underserved populations, which are Black and Latino men who have sex with men and Black women who seem to still be struggling with getting the care they need. This District of DC is constantly developing new campaigns, new programs to serve as many people as possible and to reach the populations that are still at high risk. They have developed social media prevention campaigns with involvement from the community at risk, so that those people can inform on how to best reach and serve them. The focus at this time is the youth from 13 to 20 years old, Black and Latino men who have sex with men, and Black women. The community involvement improves the impact and the engagement because, like I said, if the communities at risk are the one giving votes to what's going to happen, they're actually involved and they show up to the events or the testing sites with with higher percentage. It has been shown that social media ads are effective, but dating site apps are not effective in distributing prevention methods and awareness. There are always barriers to progress. Right now, the one of the challenges are housing, education, and unemployment status. Um, they are seeing that, like I said, the high risk youth population are not, or they are either ignorant or they are scared to access PrEP for prevention methods. And there's always a stigma with HIV status and also the lack of awareness. Or another barrier is people don't know their HIV status. So if they are unaware that they're infected, they're not taking prevention methods. The district has certain goals. They update their goals every couple of years, and for 2025, their goals were to go from 94.9% of people knowing their HIV status to 95%, from 86.3% of people who have been linked to care to 95%, and from 57.6% of people who have attained viral suppression to 95%, and PrEP coverage from 59 to 50%, which it seems like they have reached the goal, but there's always room for improvement. The main website where things are updated faster and with a lot of precision is ahead.org. Um, they are DC is focusing on targeted testing and campaigns focus on the younger population, everyone who is sexually active, and they have been engaging local communities for event planning and widespread testing and targeted testing. They continue to update their plans, their goals, and kind of evaluate what is going on so that they can better serve the community. The only thing that has been shown to work is collaboration between government and community entities for there to be to reach everyone that is at risk. Thank you so much. This has been my presentation.